Good afternoon, everyone. Good afternoon, everyone. That's more like it. You know, we are in Banyakone Kwetira and Abantu Batinde Mani. So you have to show that you have a mani, and we really move our agenda forward in a kind of relaxed way, okay? I know cancer is a very hard topic, but we're discussing a solution, which should be a brighter, a brighter mood, right? So with that, I'm just going to take us through something that I've written down just because I didn't want to forget. Sometimes the nerves kick in, right? But anyway, cancer is one of the greatest health challenges of our time. Yet, perhaps the greatest challenge is not discovering new treatments, but ensuring that the remarkable advances being made around the world become accessible to the people who need them the most. A few days ago, as I was preparing for this particular panel, I had the opportunity to listen into our conversation on translational science and medicine, focusing on oncology. Oops. And the most powerful question was, how do we move from innovation to access? How do we ensure that scientific breakthroughs do not remain confined in laboratories, academic journals, or a handful of specialized hospitals, but become a part of everyday care for people everywhere? That question stayed with me because it speaks directly to the reality facing many low and middle income countries, including Uganda. Around the world, we are witnessing extraordinary, just once again, something that happens with tech, multitasking here. Next time, organizers, we need the lavaliers that are handless. But around, we're witnessing extraordinary advances in precision medicine, artificial intelligence, immunotherapies, molecular diagnostics, and radiation oncology. The science is progressing faster than before, yet millions of people will never benefit from these innovations. Not because science has failed, but because there are too many barriers that still stand in the way between this discovery and access. A life-saving technology that cannot be financed cannot save lives. Evidence that never influences policy cannot change a health system. Innovation that communities do not understand or trust cannot improve outcomes. Scientific progress achieves its greatest value only when it reaches the people. Now, for Uganda, this challenge is especially relevant. Our country has exceptional clinicians, researchers, institutions committed to improving cancer care. The question is no longer whether innovation exists. The question is how we create the conditions for that innovation to reach every patient who needs it. That requires stronger health systems, meaningful partnerships, public trust, and sustainable financing. It also requires us to recognize a resource that has always been one of Uganda's greatest strengths, its diaspora. Every year, Ugandans living abroad send hundreds of millions of dollars home to support their families. The remittances pay school fees, build homes, support businesses, and help families through times of illness. They are a remarkable expression of love, responsibility, and commitment to home. But when it comes to cancer, individual acts of generosity are often not enough. Cancer requires specialized care, expensive equipment, and so many trained professionals, of course, reliable supply, chains and that sometimes break, long-term investment. The challenge before us is not to replace the generosity of the diaspora, but to create trusted, transparent, and sustainable ways of channeling that commitment into stronger cancer care for all Ugandans. That is why communication and financing are so important. And selfishly, I add communication because that is really my background. Communication helps build trust, align partners, demonstrate why investing in cancer care is not simply a health priority, but an investment in families, communities, and we have a lifesaver here. Thank you, BKI. Where was I? All right. I would say lifesaver. Thank you, Ambassador. Always the team player. And financing turns innovation into functioning health systems. It enables investments in infrastructure, workforce development, medicines, technology, and patient access. So without communication, good ideas struggle to gain support. Without financing, good science struggles to reach society. Together, they make progress possible. So these ideas are no longer theoretical. They are beginning to take shape through the Global Cancer Financing Platform, an innovative partnership that seeks to mobilize sustainable investment for cancer control in Uganda. Uganda has been selected as one of the pilots for this program. And this pilot we're hoping to launch in October in Uganda, marking an important milestone in bringing together government, development partners, academia, philanthropy, private sector, and diaspora around a shared vision for this future of cancer care. That brings us to today's panel. Investing in life for cancer control in Uganda through the innovative Global Cancer Financing Platform. We are very privileged to be joined by three incredible individuals who have each played an important role in shaping this journey. Her Excellency, Ambassador Robbie Kakonge, has provided leadership in strengthening partnerships between Uganda and the international stakeholders, and has been instrumental in positioning Uganda as a pilot country for this initiative. Thank you. Professor Wilngwa, he's the founder of the Global Health Catalyst, and has spent years bringing together scientists, clinicians, universities, governments, industry, and communities to advance global collaboration for cancer care. And just like you saw in his bio, he's really not a small person. He's running a lot of things. So thank you for being here. And he really just flew in today for this panel. That shows commitment. And he's flying back after this. And then Dr. Catherine Young. We've all heard her bio. She's the lead for the Global Cancer Financing Platform, a conversation that started when she was in the White House. And her experience is very, very important for us to tap into as we build this. She has the vision for this new approach for financing cancer control that emphasizes accountability, measures outcomes, and long-term sustainability. So together they will explore how Uganda can build a future where innovation, matched by investment, where, this morning we talked a lot about investment, where partnerships create opportunity, and where the generosity of all of us as diaspora and expertise become part of a coordinated effort to strengthen cancer care for generations to come. So these are part of the members of the team that have been, but we're a bigger team, and I don't know, Kosea, whether you can show a slide just before I invite our first speaker, Ambassador, just to show who else has been working behind the scenes. And if you're not ready, we can always show that at the end. That's not a problem. But as we work toward that, I would like to introduce our distinct first speaker, Her Excellency Ambassador Robbie Kakonge, whose bio has already been read. I had prepared it, but Gloria has done a fantastic job in her absence. But please, Ambassador, please come and give us a word before we start.
Good afternoon.
Good afternoon.
Oh my goodness.
I know,
Good afternoon.
Good afternoon.
I want to welcome you to this event on behalf of the organizers of the Political Time Recovery. I also want to thank you, Vivian, for being persistent. This conversation started 4 years ago. So in the last 4 years, alongside Dr. Will, we have been to Penn State, we have been to John Hopkins, we went to Harvard and the MIT thing. But more importantly, you know how Vivian said he flew in here today? Guess what? A year ago, he flew to Uganda. Not only did he fly to Uganda for this, but he flew there with Dr. Catherine. There's a team, so they invested. We were actually supposed to have launched something a few weeks ago, a few months ago, but something turned up and it starts with an E. I won't get into the details. But we are going to persist. So we have the launch. It's going to take place. I want to try something here and see. Where's the other light? Okay. So, this is the thing, right? We're here. I had hoped that when I switched these lights off, we'd be in a pitch dark place. But we're not. There's still some light. But we're in this room together. We're all here in this room together. We know about cancer. All of us know somebody who's been impacted by it. So what is our responsibility? Are we going to stay in this semi-dark room, in the darkest room? Is that what we're going to do?
No.
Yeah, so if that's not what we're going to do, then we're going to have leadership and we're going to get things done. And every single person in this room can do something. You can decide to turn the lights off or you can decide to take action. And what action is there? With government, we've put together an enabling environment. That's leadership. We have the Uganda Cancer Institute. It is a center of excellence in East Africa, if not Africa. So we want to know, like Gloria mentioned, we want to know what is your area of expertise. Because my area of expertise is not technical. My area of expertise is communication and leadership. So you show me, you tell me, you share with us what is your area of expertise, and my mandate is to lead you there on this ship. No one else is going to turn these lights on for us. There's no one. It's us. It's you we're depending on in terms of your expertise, in terms of showing up. And I want to thank every single one of you in this room. This is the beginning point of showing up. And I don't want this conversation to end here. I want you to take the initiative, and I know Dr. Will, as busy as he is, but if we said, Dr. Will, if we take 2 or 3 points from here, you know, and in the next, because we're starting our financial year, it starts July 2026 to July 2027. And if we said in the next, if we have like 3 or 4 areas, and we said that in the next 1 year, once every quarter, if you can just guide and have a dialogue with us, as busy as he is, I know he can commit to at least 30 minutes of that.
Absolutely.
So, thank you very much. And I say, I'm committing you before, right? So really, that is really my challenge to you. That is my ask of you. Because either you're part of the solution or you're part of the yeah, and we don't want problems, right? So I won't take much of your time because they have the answers, you know. I'd rather we spend this time them sharing so that in case you have questions, we'll give you the time. But other than that, they've shifted, things have shifted. And with the embassy, our key factor is economic and commercial development. But also, health is part of our wealth. So, if nothing else, think about how, not even being, you know, because people say, oh, I'm sick or I'm not healthy, but also the determinants of health. What are those determinants of health? You know, you can be unwell, even being unwell is sick, and it costs something, and it could be an indicator. So if nothing else, if you're not a technical person, maybe you're a mobilizer. Maybe you're good at talking to people, sharing with people. Maybe you're good at, you know, comforting people. Maybe you're good at whatever it is, because when people have others who are suffering from cancer, they need that support. So maybe it's some sort of lifeline that we can do. So every single one of you has a part to play. So the thing is, how can we begin this conversation? And if we don't know how, between Dr. Will and Dr. Catherine and Vivian, see Vivian here, she's a gem. She's a gem, you know? She works tirelessly, 24/7, first time, right? We can't thank you enough. And even in putting this panel together, this is not the first panel. When you had the Banyachigezi event, it was like 2 years ago? 2023 years ago, you know? Even there, we had a discussion, and you were very active in terms of what you're doing. She's also really, it would be a good conversation. You can write a book on this. You really can. If nothing else, a podcast. Because she already does interviews. So I hope you can share where they can see you, your health-related interviews. And she's highly, highly rated. Harvard highly rated. But more importantly, she's one of our own. You see, this is the diaspora. You have the answers and the solutions. So thank you for being selfless and a gem. We don't take it for granted. I hand the mic back to you and you introduce them. Okay, thank you very much.
Let's give another round of applause to our ambassador. Really, she truly is the gem, because without leaders, we cannot do this. You know, we might have ideas, but if the leadership doesn't buy into it, then it really goes nowhere. So thank you, Ambassador, for being our true leader in this. And with that, I'd like to invite Dr. Will Ngwa to take us through his presentation, including incidences and why we're doing what we're doing today.
Well, thank you so much. It's really an honor to be here and be able to talk to you. I have to say that, I wouldn't be here. We're all inspired by Ambassador's leadership. And she's really inspired. She's so passionate about making sure that Ugandans, that we do something good for Uganda, not just in the development, but also in healthcare. And like you said, health is wealth. So those are all connected. But more importantly, it's really important that you are here to be able to be part of this conversation. So in my part, what I'm going to do is I'm just going to tell you a little bit about why you are so important to this conversation. and why we have to collaborate. Collaboration is really key here. So next slide, please. Yeah. So I mean, you want to ask this. When Vivian was talking about cancer, why are we talking about cancer? And I can say that there is a reason why, but we can obviously extend that. It can be a foundation for this, but we really we can extend that to other things, mental health, other non-communicable diseases as well. So just looking at the statistics, cancer right now, there are about 10 million deaths per year from cancer. If you remember COVID-19, if we want to bring that same urgency just because of the number of deaths, we should multiply that urgency for cancer. Okay. Globally, about the time I just talked to you, about 20 people died of cancer. Worse is that the World Health Organization predicts that cancer is going to become more prevalent. Like, it's not going away. It's going to increase by 77%. And now look at the map over there. The red, it's not just that it's a crisis, it's also what Vivian was talking about, access. So if you look at the red means if you're born there, and you have cancer, you're more likely to die. Now I'll give you statistics. 5 out of 5 kids who have cancer in the United States, 4 will likely survive. 5 who have cancer in Uganda or other African countries, 4 are likely to die. It's all flipped, 80%. And that's why you see the red, it's mostly Africa. And then, I remember this quote from the BBC a few years ago. I always talk about it. It was a rhetorical question. Do US dogs have better access to radiotherapy than Nigerian people? Nigeria is one example of the country. Sadly, the answer to that is yes. Sadly, that's the answer. Next slide, please. But I have a quiz for you. So if you look at this, advance, please. So, yeah, please advance. You should be able to show. Go back. It's not showing that. So the graph really I wanted to show you was in Uganda, which one disease do you think is the highest killer because of death? You'd have seen A, B, C, D, E, and I wanted you to figure out which one is the right answer. The answer is cancer. Right now in Uganda, about 35,000 people die of cancer every year. And it's an underestimate. We know that because some languages don't even have a word for cancer across Africa. We know the 2,000 dialects. So sometimes when people die of cancer, we call it something else. It's witchcraft, it's some other thing, right? And so awareness education, like Ambassador was saying, if you cannot do anything, if you're wondering, hey, you're talking about cancer, you need a healthcare, you need a doctor, if you wonder what you can do, you can even just hit the drums and say, this is a problem. You can advocate. You can advocate. You cannot not be able to do something about it. So, next slide, please. Yeah. And I want to show this slide. It's really graphic. It's actually taken from, this woman is from Ghana. But we see the same things happening across sub-Saharan Africa. Most of the time you catch the cancer late. We did this Lancet Oncology Commission for most African countries. It's always characterized by late-stage disease. By the time you catch it, 80% of women already have late-stage cancer. So if you look at that graph up there, the leading cause of death in Africa in cancer is breast and cervical cancer. Those are the ones. And then prostate cancer for men. So part of the culture actually has become an impediment in the sense that we don't want to talk about it. The culture is that when you have cancer, people equate that to death. So it's a kind of a negative feedback because we know that when you have cancer, you're likely to die. So when people have cancer, they don't want to talk about it. And then they only come late, and then it means they're more likely to die. So it's kind of like this cycle that's really bad. Next slide, please. But I want to point out something that Ambassador talked about, which is essentially that, cancer is not just a health. Obviously, lives are the most important thing, but cancer also has a major impact on the economy. So when we did the Lancet Oncology Commission for Sub-Saharan Africa, I put Uganda at the bottom there. So actually just to estimate the economic cost of cancer in the country. And when I put that cost there, it really comes to what, when people are sick, they cannot contribute to the economy. They have to stay away from work. You have to pay costs for the health care, all of that. So per year, it's almost $600 million per year in cost for the country. And so that's something that it's not just, it's an economic cost. It affects our economic development as well. And so brings us to the most important conversation today is really that since Catherine did an amazing work in the White House, we started working, we actually had, like Ambassador mentioned, started having conversations with Uganda and other countries since then. Part of our job was to extend President Biden's cancer money shot globally, and they talked about it in her CV, the commitments that she was already making towards that. But if you see this graph, you see that the financing, the global financing for cancer has gone down, right? It's going down. So what it means that, while cancer is increasing and the number of deaths are increasing, the funding towards that is actually going downwards. So it means that we have to create innovative ways of supporting this, and that's why we're here. Here about the cancer financing platform is an innovative approach to that. All right, so I'm going to talk about something that Vivian mentioned. So we started this conversation again with Catherine convening ministers of health and other people to the White House. We started saying, hey, you know what? If you look at innovation for financing, the diaspora is the Wakanda. I can say this. You all are the Wakanda. If you watch the Black Panther movie, Wakanda is what? It's a fictional city, in East Africa, by the way, around where Uganda is, where it's hidden from the world, but it has so much talent. It has a lot of resources, technological advancements, all of those things, but people actually don't know that. So the diaspora, you are the secret Wakanda. Like, people don't know that power that you have. And that comes, this is just a statistics basically showing that the remittances that go, if you think about funding, we send remittances, Vivian mentioned that, hundreds of millions. I think Uganda is probably over a billion per year. Okay, you're sending this obviously to help family and all of that stuff. And so we are here to kind of tell you that there are innovative ways where you can keep sending the money the way you're doing it, but in addition to that, you can make that money work towards supporting, the fight against cancer and promoting development in your country. So you may have seen in my initial slide was like the Wall Street, for cancer, for global health, which means that you can make money while saving lives at the same time. So health and wealth is one of the conversations we're going to have today. Next slide. So the amazing ambassador. Typically, I really think she deserves many awards. She's really taken this leadership to facilitate these U.S., Africa, Uganda collaborations. And these are just three. She mentioned some of the conversations we've been having all this time, and so Uganda is really positioned as a leader here. There are other countries that are now really coming up. They want to do the same, but that's because they are getting that visibility and leadership from ambassadors as well. So just back a little bit, we just want to mention the Uganda Cancer Institute. So we're there back in December 2025. In the picture, it's definitely one of the centers of excellence in not only in Uganda but in Africa. And so they are really championing this to be the hub, because you don't want to do this. You want to make sure that patients, if you're doing this funding, you can really, that's what we want to do during the launch, actually have patients who are benefiting from this, be able to come and testify that, hey, the money you sent, through the platform we're going to be talking about, here's how it helped, and they had access to care at the Uganda Cancer Institute. So we are currently planning, we had a delayed launch from June 24th, so we've moved that later on to this year. And so, obviously, we've had additional conversations at the embassy. Ambassador has been able to host, engaging the diaspora. And yes, I really stand committed, and I think Catherine too, and all of us, that we're going to continue to have this dialogue with you, making sure that you answer all your questions, explain what's happening, provide the trust and transparency that you think, that's the big factor, and how this platform will work to really make sure that you are saving lives, but not worried about, and also seeing how your money without additional, the platform having that trust and transparency. So next slide, please. So yeah, I want to tell you a little bit, so this is kind of a dense slide, how the global using your remittances will work. Okay. So right now you use, I don't know what you use best, Western Union, MoneyGram, you can use, there are many financing platforms, money remittance platforms that you use. This is going to sit above that. What that means is that this is a platform that, we believe that you can use with any of those remittance platforms. Why? Because, you're sending the money the way you're sending, but you can actually choose to make that money work for you in two ways. One is through vouchers. So a voucher just means that, hey, you go on this platform, you see, Akelo, from northern Uganda, wishing a deal with cervical cancer or breast cancer, and she just needs to get screened. She needs $5 or she needs $1. So when you're sending $100 home, you could decide that, oh, you just want to give $1 to that to support her. The cool thing is that we call it the Wall Street because you can get on the platform and you can actually see your money where it is. Okay, technology today, blockchain, transparency, all of that. You see where your money is. The money is only released to help Akelo if she is verified after she's received the service. And it's not only the Uganda Cancer Institute telling you that she's received the service, she's verifying, and there's a third party verifying, including AI, the tools that we have today, right? So you can actually see your money working for that. And that's kind of like a goodwill thing. But you know what, we're actually going to be working with these remittance platforms where, you probably pay $10, for your remittance, but just $1 out of the $100 you're saying you pay $10 can actually get to work and help the country. Another way is bonds. So a bond is really a loan that you're giving, and that's an investment. So, most of you maybe have like retirement through your work. You're giving that, it's like an investment on Wall Street. What if you could decide that as part of that you want to invest some money into Uganda, right? It's going to go towards building that infrastructure. You can build a hospital, you can buy a CT scanner, a diagnostic machine, but guess what's going to happen is that money, you'll be paid back. And you actually be paid back with some interest. So the money gets to work for you just like you put it on Wall Street, and actually you do that and some people are managing that fund for you. You don't even know what's happening. You just know that eventually you get some interest coming back to you, right? But what if you could do that for your own country that you love, right? With that confidence and trust that you're gonna get your money, even just getting the money back, right? Without even the interest, that would be a big deal. But we're talking about bonds here. So just looking at this graph, I'm gonna run quickly to this. So funding layer 1 is diaspora communities, that's the engagement. We have been talking to diaspora communities, but also faith-based communities are really interested in this. People are doing missions, they just wanna help, right? They wanna, and then philanthropic foundations, Bill Gates, and then it's a good example, development partners like African Development Bank, all these other people. But the key thing is that with diaspora will be one of the provider kind of catalytic funding that also creates this momentum for these people to provide money. And then next is really the platform itself. The Globex, we call it Globex, Global Health Bond Exchange, it's just a name for that. And so basically there, we've already worked with Uganda Cancer Institute such that they've identified specific key performance indicators, which means that they give a budget, just like you pay your electricity, it's a 1 unit. Here's how much it costs to screen a woman from breast or cervical cancer. Here's what it costs to train one person. And they've kind of put the amount for each of those units, the key performance indicators. So when you go on their platform, you're buying one of those units, right? So you're basically saying, I want to screen one woman today, it costs $5. So you're basically, what your money is buying. And that money will only go towards that particular purpose. Like, it's not going to go somewhere else. Actually, now when you send money home to your family, you're sending for healthcare, Sometimes they take the money and they don't go to the hospital, right? They could use it for something else. You don't really get to know. But in this particular case, the money goes only to what you wanted it to do, right? So if you want your mom or your sister to go and get screened at the Uganda Cancer Institute, guess what? She's only going to be, that money is only going to be used for that purpose. So they cannot use it for something else. And you can track it. There's going to be validation, like I mentioned. So that takes us to this third layer, which is what, through the leadership of Ambassador, the Ministry of Finance, and all of this, this is a special purpose vehicle, SPV. It's created only for this. It's going to ring fence your money. So if you send $10, it stays in there. Nobody can touch it. You can actually see it sitting in that bank or found that particular special purpose vehicle. It only gets released if Akelo has received that service that you wanted her to get. Or only if they've bought that CET machine that you want in the receipts there. You can launch, you can get on there, you see the receipts, you see verification, a third party, not just take my word for it. You actually get that verified. Blockchain allows us to do that with that technology. So through leadership, we had that engagement. In that picture we showed, we went to Uganda, we had a working relationship with the Ministry of Health and Finance and Foreign Affairs, and they have committed, so this is moving forward. So part of that launch you're going to do. And then finally, stage 4 is with service delivery. So Akelo comes in there, she gets screened or diagnosed or treated. And then the money is verified first before the money is released. So actually you pay for the service, it's only released after the service is delivered. So nobody can take it and use it for something else after it's been verified. And then you get essentially a feedback telling you that this person has done it, you can track and you can see the reward. And the person, if you're just giving a voucher, the person can give you a message basically say thank you for doing this. So it's all tracked. And so you have this end-to-end platform that allows you to have a transparent and accountable in financing of health. Next slide, please. And we'll have time to ask a question. So I'm going to quickly conclude because I know I've gone beyond my time. Next slide. So I want to show you this picture. This is the Wall Street for global health investment. So if you're going to get into this on the platform, this is the kind of picture that you can imagine, right? You can look across Africa. We're starting with Uganda, but I can tell you how many other countries want to be part of this now, and I've been working with already. So you can look at the data, you can really see, which are the, what your money is doing. The graph there will tell you, here's the number of cancer screenings you've gotten in Uganda, and at what time, where is the money sitting? You can see that transparently, just like when you log onto Wall Street right now, you see where the stocks go up and the stocks go down. You can track all of that, and so you can really see your money working. Right now, when you send your money home, it's blind. You don't even know where it is. Until maybe your family would say, okay, I took the money, but you don't even know what they did with the money. They may tell you, but you can verify. Through this, you get the verification and the trust. And so one of the next milestones, actually, as Ambassador said about continuous engagement in September, we also are going to have the next stop, the Global Health Catalyst Summit at Harvard. Again, we are inviting all of you to that. We're actually going to have a really additional conversations with the diaspora. There we'll also have other faith-based organizations and also the development banks and other people who want to really be part of this, so that they can see that collaboratively we can make a huge impact. In cancer is going up, funding is going down. We are finding innovative ways, something that we can do for the country that we love, with transparency, trust, and accountability. So that's the message that we want to take here. Last slide. Yes. So thank you very much. We're all welcome to this. Vivian, I know, has already been. Yeah. Thank you so much.
Let's give another round of applause to Professor Will. He's bringing a lot of, although today he's specifically talking about this global cancer financing platform, he's really championing so many things, so many clinical trials where Uganda is involved, has been a part of for so many years on prostate cancer with new therapies like, I'm not an oncologist, so I don't want to, misspeak, but in addition to that, he's leading a government-sponsored initiative for cancer treatment in the United States and globally, just being awarded by the US government. So he works with the US government, and now we are privileged that he can be working. He's working with us in Uganda, so we are tapping into that. So thank you so much. And with that, speaking of governance, our last guest panelist is Dr. Young. You've already heard she used to work with the White House on this cancer. We're trying to expand the cancer moonshot globally, and now the conversation continues. So she's the lead for the Global Cancer Financing Platform. Dr. Young.
Thank you so much, Vivian, and thank you, Ambassador, for being here and for all your support. I did have a presentation. While we wait for that, I just want to say, although I'm originally from South Africa, please don't hold that against me. I also very much appreciate being invited into this Ugandan family, so thank you so much. And I'm looking forward to sharing more with you once I get my slides.
Isn't technology amazing?
Yes. Can you take a question with that?
So how many, just out of curiosity, they kind of bring us up to speed. How many of you followed the White House campaigns on cancer before this? Oh, we have all right. What did you follow? Just curious.
Personally, I was interested in the moonshot.
Okay.
I've had a lot of cancer patients and also my own family. I lost almost 5 siblings
Oh,
to different cancers. So I started researching to know whether we had the cancer markers in the genes or what. Because it wasn't one type of cancer that took my siblings. And when government said they were going to fund cancer research and put in a lot of money, I was very impressed, and I was hoping Uganda would benefit because I come from there and I've suffered personally.
Well, sorry for your loss. And that is, and you mentioned something very interesting, the biomarkers. That's a whole conversation where treatments are being developed but they are based on people here, and they don't work on us because we have different biomarkers. And these are some of the things that Dr. Will, when we say clinical trials, they're focusing on that, on our people. How can we create biomarkers that actually have treatments that are targeted for us? And for women, there's a lot to talk about, but I think the presentation.
Thank you, Vivian. Okay, so we're going to get started about the Global Cancer Financing Platform and really what is it. But before I start, I want to just ground us in this current funding reality, which is why we are doing this in the first place. So the next slide, please. The financing landscape has fundamentally changed over the last 2 years. So this graph here shows that development assistance for health, which is what money that many countries around the world would provide, low and middle income countries, to be able to support programs and initiatives for health, has severely been reduced within even just 1 year. So between the year 2024 and 25, development assistance went from about 50 billion to about 39 billion. So that was a drop of 21% in just 1 year. And we actually believe that this trend will just continue to go down. By the year 2030, we expect that to be around $36 billion. And this is in comparison to what Will was saying earlier, and also Vivian, where when we compare the amount of funding that is available for health and disease, there's a big mismatch here. So when we think about non-communicable diseases, which are things like cardiovascular disease, diabetes, respiratory issues, and cancer, those specific, that umbrella called NCDs receives only 1 to 2% of all global health funding. And actually, when we look at the number of deaths that occur because of those diseases, it way eclipses everything else. So the question always is, why are we only receiving 1 to 2% of this money, when in reality, these diseases is what's causing most of our deaths around the world? Now, if you think about cancer, which causes 1 in 6 deaths in this world, that receives a fraction of that 1 to 2%. So the amount of money that is going towards patients around the world is just minuscule in this case. We also know, one last thing is that 80% of all cancer deaths occur in low and middle income countries. So the burden of deaths really lay heavily on these countries. Thank you. So what our big effort here is to unlock capital that cancer hasn't necessarily unlocked before. Now, it's not to win a bigger share of this shrinking pool that I just described, but where is capital already moving that hasn't been part of the cancer conversation before? And that's what we're trying to tap into. And to Will's point too, how do we build the trust, transparency, and accountability to connect that financing to the patients that need it the most? Next slide, please. So to do this, we launched the Global Cancer Financing Platform on the margins of the UN General Assembly back in September of last year. And this moment allowed us to really announce the major goals of this work. The first major goal is to mobilize at least $1 billion by the year 2030, and that amount will be sustainable year after year. So this is not meant to be a one-time fundraise and then for us to retract backwards. This is meant to be a sustainable thing. The other thing that we announced is that there were 7 countries that signed on to our declaration of support, and I will say that Uganda was the very first signature on this particular work. So thank you, Ambassador, for all of your work in securing that. And finally, the Ambassador announced that Uganda would be our first pilot for this work as well. Next slide, please. The last thing we announced at the launch was what exactly we would be focusing on. And we are focused on the idea of stage shifting. So what does that mean? What does stage shifting mean? It means catching cancer earlier. So instead of being diagnosed at a stage 3 and 4, where we know the outcomes are so much worse, we know that there are far less treatments, and we know that chances of survival decrease dramatically and increase the burden on the healthcare system, we want to be able to either prevent it completely, or if we do diagnose it, it occurs at stage 1 or 2, where we know the chances of survival are going to be increased so dramatically for patients. Now, also the really interesting thing is the WHO has a lot of frameworks around stage shifting already, particularly for breast and cervical cancers. And so these are the 2 cancers we are focused on first, and then we will scale to other high burden cancers once we're able to actually showcase success in this case as well. And this is really important because the graph on the right hand shows us that for cervical and breast cancers, when you catch it early, the 5-year survival is about 91% in both cases, and you can see how that dramatically gets reduced when you catch those cancers later in the stages as well. So this is a really important thing for us to all be working towards, is this idea of stage shifting. So next slide, please. So the next phase is already underway, and Will had mentioned this before, but we have been designing the foundational pieces of this work, of this pilot, together with the ambassador and together with the Ugandan government as well. And we're going to be testing several different mechanisms, which I'm going to walk through here with you in just a second. So the pilot must answer 2 fundamental questions here. First of all, where does the money come from? So that's just such a basic question, but this is actually a very difficult question as well, and it's the very, very most important question we have to answer, and this is where you are going to come into. And the second one is what happens to the money once it's been unlocked. So we don't want to just give money away. We want to make sure that funding that is provided is actually going towards the needs of the country, and that it is going towards the national cancer plan that has already been designed by the people who understand what the needs are in Uganda as well. So next slide, please. Now, this is where you come in and why I'm so happy to see so many amazing, beautiful faces in this room. So as Will mentioned before, the global remittances sent by the diaspora around the world is around 685 billion. That's in 1 year. Now, to put that in some perspective, that is larger than foreign direct investment and official development assistance combined. It is the largest financing stream available in this world. And cancer has never tapped into that before. If we put it into even more context, that means we would spend $1 million every day for the next 1,918 years just to get through that $685 billion, which occurs in 1 year around the world. So that's how much money is being sent. So the diaspora, of course, we are all deeply tied to our countries of birth, right? We want them to thrive. And many of us still have close family members living there, which is why we want our country to thrive. So this is the community we are turning to first, which is you, because the money that you send home through remittances has been entirely absent from this cancer conversation before. Next slide, thank you. Right, so we know that 685 billion gets sent around the world. Over 100 billion gets sent to sub-Saharan Africa. And of that 100 billion, 1.5 billion gets sent to Uganda. That's roughly 3% of your entire GDP. That's a huge amount of money. That's the largest, most resilient external financial flow to any of these countries that we're trying to serve. It is stable and it also is also ever increasing. Just to put it in final perspective, over the past decade, financial development investment, which is again this global health funding from around the world, has decreased by 41%. While remittances over the same time period have increased over 57%. So this money is not going away. In fact, it's just increasing over time more and more. Okay, so let's talk about remittances, because I think this is a really important point to make very clear. We know that remittances are a lifeline back to your family members back home, and we're not asking you to take away money that you're sending to your family members. The private money that is sent home for food and education and survival, that is so necessary, and we would never ask you to kind of dip into that and to kind of, you know, put it towards something else. What we are looking at is collective money. Yes.
We have 2 minutes.
Oh, fine. Yes. I'll be in my time, don't worry. What we are trying to do here is look at how we can collectively pull this money towards public goods. And in this case, what we're building for cancer, we can use Mexico as a great example. They received 64.7 billion in remittances just in 2024 alone. And they have a program called the 3x1 Migrant Program, where diaspora groups actually pool money for community development, and then that is matched by the government and other private or philanthropic money. So we can use the example of remittances of 1.5 billion that enter Uganda every year. If we take 1% of that money, that's about $14 to $15 million. If we have a 1-to-1 matching program, that becomes $30 million. And if we have a 3x1 matching program, that goes up to $40 to $60 million. Could you imagine if we could do that just for our cancer patients in Uganda, and what a difference that might make? Next slide, please. The second mechanism we're testing, and Will had mentioned this, is vouchers. So this is financing a very specific step in the cancer journey. A diaspora member doesn't have to donate into a system and just simply hope that something happens at the end of it. In this case, they can purchase a voucher for a very defined step in that journey. So say, for example, a cancer screening. The voucher can only be used for that particular screening. But imagine a case where we also have a matching program for this. So a diaspora member pays $100 for a voucher that gets used for the family member on the other side for a cancer screening. Imagine now if there's a one-to-one matching program with that. Now all of a sudden you've created value for that voucher. So now it's $200 instead of $100 value, or if there's a 3-by-1, it's $400 as well. So this is not a skip the line type of system. This is a credible way for family members abroad to concretely fund care that is necessary for the people they love. And there is actually a very proven program around vouchers for health in Kenya as well. So we are not trying to reinvent the wheel. We are not trying to come in and say, oh, we're going to try this out and see if it works. We already know in different countries that this works. What we're trying to do is adapt it to cancer specifically. Next slide, please. Will mentioned, and very importantly, our last mechanism is bonds. Here we are looking at you as investors in your country, not simply as donors. And this is where the difference is. So instead of giving $10 or $100, you could potentially buy 500, 1,000, 2,000, 5,000 cancer infrastructure bonds, right? This is not a donation. This is an investment. As Will said, you will get it back with interest in return over a set period of time. Imagine if we're able to use a 14 to 15 million remittance annual flow. That could literally become almost a $200 million financing facility. With that money, you can build pathology systems and imaging capacity. You can build regional diagnostic hubs, radiotherapy units, and digital referral systems, and increase your workforce. This is where the investment in your country actually starts to build the entire system so that it now starts to actually help everybody in the country, not just your cancer patients as well. And again, this is proven. Nigeria has an African diaspora bond which raised hundreds of millions of dollars for infrastructure in their country. So we know it works. We just want to, again, adapt it to cancer. Next slide, please. I'm almost done. Okay, so the other question we had to answer is what happens to the money when we get it? And in this case, we want to treat the finance that comes into this platform as infrastructure. We want to treat cancer care and control as infrastructure. What does that mean? So the roadways, your electrical grids in the country, your water systems, those are systems that have been designed and financed over time because it is so necessary for survival to occur. We want cancer care to be thought about in the same terms as that. So it's financed through layered sources. So we talk about looking at you, the diaspora, for contributions, but ultimately that's just one part of it. We will also be looking at the public budgets, the development finance banks, private capitals, all the other pieces that will play a role in how we think about cancer control as infrastructure, because that is how we start to actually change and develop the systems the way that they are required to do. Next slide. And as Will had mentioned, the way that we are thinking about this is that it has to be, the services have to be verified first before the financing is released. This is a very different way to think about this. And so we are testing, in a way, a new model in how to finance cancer. The only way that your money will be used is if the services have already been provided and that they have been verified at the end as well. Next slide, please. Lastly, I'll just say, this model cannot be designed around a country, it must be designed with one, which is why we are so grateful for the ambassador, the embassy staff, and the entire Ugandan government that we've been working with, all the sectors who are part of this process. They're not just simply a bystander around this as well. So it really is a condition of success, and Will had really laid this out well. We have worked with across the sectors of the Ugandan government, including the Treasury, the Bank of Uganda, the Ugandan Cancer Institute, and of course our colleagues at the embassy as well. Next slide, please. Finally, I will say, I used to think we were building this financing platform, but ultimately what we're building is a partnership platform. And everybody has a role to play. Everybody has a seat at the table. Next slide, please. So I'm sorry. We've already started to get commitments from major cancer organizations in terms of how they will be playing a role in this work in Uganda. So some of these, the American Cancer Society, the American Society of Clinical Oncology, massive, some of the biggest cancer organizations in the world have all already committed to working with us to making sure that we build together the systems that are required for this work to be successful. Next slide. And the last thing I'll say is that you are part of those partnerships as well. We view you as a partner in this work. And so if you would like to become a part of this work, or if you're interested in just following along in this journey, understanding the progress that we're making, please just take a snapshot of this, input your email if you're willing, and we will keep you up to date on all of this work. So with that, my last slide is just to say thank you to all the organizations who have been committed to this work. There's no, oh yeah, and to everybody here in this room for your time today. So thank you, Vivian, over to you.
Let's give her another round of applause. Thank you so much, Dr. Young. But most importantly, thank you all for being a part of this conversation. We thought 1.5 hours was a lot, but it's actually, we've run out of time. So here's what we're gonna do. We're gonna improvise. So there's another session coming in. So what we're gonna do, we're going to, unplant ourselves in the lobby for those who have questions, so that we can answer them there, because we don't want to, though a few questions, we'll take a few questions, so that we leave the room for other people who want to use it. But first of all, a round of applause to all our speakers, and to the ambassador for really gracing us with her leadership. And I'll just invite her to close this session, because that's protocol, I think. I don't want to miss protocol. And then we will move to the lobby.
Thank you once again, everyone, for your kind attention. And I also want to thank you, Dr. Will. I want to thank you, Dr. Kathy, of course. It goes without saying, Vivian, blessings upon blessings. I'd like to acknowledge my members of the embassy who work tirelessly. They're doing double duty. They have 1 foot here, and they also have 1 foot at the consular services doing the IDs and passports. So I wasn't able to introduce them in the beginning because not everybody was in the room. But if you can just stand for a minute so we appreciate you. Philip also was part of the delegation that went with Dr. Will and Kathy. He's the second secretary. And we have the first secretary. He's also the accounting officer, Money Matters. Mr. George, thank you very much. And then we have Mr. Benon, George Tibekan, Philip Lucy. And then we have none other than our MC, Minister Council, Benon Kayamba, thank you very much. And all of these combined bring a great deal of experience from Ministry of Foreign Affairs. So we've been able to make sure that this particular investment opportunity is opening the gateway to other ministries. So we reached out to Ministry of Finance, Bank of Uganda, and all those other entities so that they're part and parcel of this decision. So somebody, we don't want to hear we're starting from across board. Thank you so much. They told us to get out of the room, so I'll stop here. Thank you very much.